Welcome to Calf Academy, your source for calf care education.
This section we're going to be talking about calf health diseases and the preventative actions that we can put in place to prevent these diseases. The first things we're going to be looking at is the performance expectations and just an overview of where we are as an industry. We're going to review the several of the diseases that are common to calves, and then we'll talk about ways that we're going to implement some preventative plans. So according to the Dairy Calf and Heifer Association Gold Standards that was written in 2013, the calf growth rates of what we could expect, it's typically doubling the birth weight in the first 60 days. So if we start with an 85-pound Holstein calf at 24 hours of age, and we get it to 170 pounds, it would have to average 1.42 pounds per day. As they wean and get on dry feed, we expect that they're going to gain 2.2 pounds per calf per day. And after that 121 day age, up to 180 days, we can think about 2 pounds per calf per day average daily gain. So two key things that we're going to look at in calf health measurements is mortality and morbidity. And mortality, we look at that pre-weaning and post-weaning. We expect less than 5% of the calves that are born between 24 hours of age to 60 days of age, less than 5% of those calves should die. That should be a goal. From 61 to 120 days, less than 2%, and then up to 180 days, that group, less than 1% should die. So we talk about morbidity. That's calves that get sick but do not die, so they recover. So we can look at it in terms of scours. Scours morbidity requires treatment after 24 hours. So in that pre-weaning period, think about less than 25% of your calves that are in that period should come down with the scours that you need to treat. After that period, post-weaning, it should be very, very small, less than 1 to 2% of your calves coming down with some kind of a scour event that you would have to treat. So the other part of morbidity is respiratory. Respiratory disease in calves happens at typically a different time than it does scours morbidity. And we can see in this slide that from 24 hours of age to 60 days of age, less than 10% of the animals should have a respiratory event that requires an antibiotic. That post-weaning period of 61 to 121 days or 120 days is typically the highest risk area for calves. They have to get through that transition stage, moving pens, grouping, all those sorts of things contribute to a higher level of respiratory disease. And here we want to try and keep it under 15%. They get through that period over 121 to 180 days of age, very low level of problems in that group. That should typically be in less than 2%. So when we look at what our expectations are for calves, we think about health, we think about growth, and of course we want animals that are going to enter the production string to have excellent productivity. So we're thinking about those three areas: health, growth, and future productivity. There's 4 key areas that we have to think about to make sure we meet those expectations. The first one is the calf has to be born, and it has to be born healthy, has to be born without any injuries, and the calf will be, vigorous to start out its new life. The second area on the right is, of course, colostrum. Colostrum is one of the most fundamental things that we need to have into these newborn animals. So, the first part of this in birth and colostrum, that all happens, most importantly, in less than 24 hours. And of course, we all know now that we want to get colostrum into those animals in the first 2 to 4 hours, maybe as far as 6 hours from birth, but for sure, we'd really want to try and get it into those baby calves in 2 hours or so. The next thing, of course, if we want a healthy growing calf, is that we have to have adequate nutrition. We have to have nutrition that can support all the functions for living, what we call our maintenance needs. And of course, enough nutrition to be able to provide for a healthy, growing, vigorous calf. And then finally, the last part that we need to look at is the environment that we raise the animal. And in this area, I think of two things. I think of sanitation and I think of ventilation. Things have to be clean and we need to have fresh air. Let's look into some historical data that comes from the USDA NOMS data. The information that we're going to look at is a summation of many farms across the United States where these farms were given a very detailed survey to complete on how they are managing their animals. So when we look at this NOMS data from 1991 through 2007, it's pretty clear if we look at age at first calving, not much change around that 25 months of age. Look at pre-weaning mortality, 8.4 in 1991, 7.8 in 2007. There again, not very much change. Stillbirths weren't collected in those first few surveys, so the only number we have there is 2007 at 6.5% of the calves that are born dead, so they're not alive at 24 hours. Then when we look at weaning age in weeks, it's actually going up. 1991 it was 7.9, 2007 8.2 weeks old at weaning. So not much progress when we looked at the surveys over the last several years. What we're looking at here is the percentage of unweaned heifers that die and what percentage of those deaths are caused by either scours, or diarrhea, or respiratory problems. So those two items make up the majority of the deaths of the pre-weaned heifer. If we look at scours and diarrhea from 91 to 2007, it's in that 52 to 62% of the deaths were caused by scours. So the vast majority, if a calf is going to die, it's a high likelihood it's going to die of scours. Likewise with respiratory problems, nearly a quarter of the calves that die will have some type of respiratory disease as the cause. Those are the two major issues, obviously, when it comes to deaths in pre-weaned heifers. So as we've already discussed, scours and respiratory disease are the two big ones. And another one we'll throw in there is Abomasal Bloat. That's typically a disease in the very young calf, usually around that 2 weeks of age or younger. So let's dig a little deeper into calf scours. So when we look at the types of organisms that cause scours in calves, we can get a list of them, and this list came from the University of Minnesota that looked at their records that showed when they diagnosed a calf with scours, what organisms did they find? And looking at it from 2005 to 2008, you can see that crypto is by far the number one thing that is found in the diagnostic lab, followed by rotavirus, E. coli, Clostridium, and then Salmonella, coronavirus, and Coccidia round out the rest of the organisms that are found in these calves. This is some of the similar information from Iowa State, where they looked at the pathogens that cause scours in 2007. The crypto was again at the top of the list, followed by coronavirus in Iowa. As you remember in the previous slide, coronavirus was lower on the list. And again, E. coli and rotavirus and Clostridium again are still very high on the list of pathogens that impact calves, certainly in Iowa and other parts of the country. So when do we start seeing these types of diseases? Certainly, E. coli is going to be the most common cause of scours in calves that are less than 7 days of age. And Sheila McGurk talks about calves that have scouring less than 5 days of age. She said it's almost always due to a manure meal. Calves get some kind of manure in their mouth when they're born. And that will show up as an E. coli type of an infection causing diarrhea in that first 5 days of age. Rota and corona are typically very early. You usually think of rota and corona being at 7 to 10 days, 7 to 14 days. Crypto the same way. Crypto can show up fairly early. Clostridium, same way. We typically see Clostridium in that 7 to 14 days. That will oftentimes show up as not just scours, but also some bloating. And then, of course, Salmonella is common throughout the period, really related to the ability to keep calves separate from one another and having good sanitation. Coccidia is not on this chart here, but Coccidia will typically show up later on, 14 to 21 days. So let's get into this respiratory disease discussion. So what causes respiratory disease? We already talked about that a little bit in the weaned animal, but let's look at some of the other items that sets up a calf at a higher risk for respiratory disease. Certainly has a lot to do with the environment and the type of housing that the calf is raised in. If there's poor ventilation or no air movement, that just allows for the levels of pathogens to increase in the air, making a very, very bad environment for the calf to thrive. Pathogen exposure is another big one. If young babies with no exposure to any type of diseases get exposed to these older animals that have been picking up some of these pathogens over time, have recovered, but they could still serve as a source of exposure to the younger animal. We really don't like to see the young calves be very close to the older animals. When we look at respiratory disease in the pre-weaning animal, oftentimes we can tie it back to immunity in the calf, either coming from colostrum or the developing of their own immunity that is just not coming along very well. And we already mentioned that transition from liquid to dry feed at weaning is another very, very common time that we'll see respiratory disease, having that poor transition. The University of Wisconsin did a lot of work a few years ago looking at how do we assess what are the key factors in putting a calf at risk for respiratory disease. And they were able to narrow it down to three main areas. One of them was how much bacteria is in the air. And you take these counts at the level of the calf in the pen. The second thing was the number of barriers, or the type of barriers that prevent one calf from having nose-to-nose contact with another calf. And then the third thing was what type of bedding does the calf live in? Is it one where they can nestle down into the straw covers up their legs, keeps them good and warm and relatively clean? Or is it the type of bedding where the calf just lays on top with their legs exposed and not being able to conserve their energy because of the lack of that nesting? So we've got nesting scores of 1, 2, and 3, 3 being the best, 1 being the worst. This is a graph that came out of that research that we saw on the last slide. University of Wisconsin people looked at these different areas and they were able to plot the 3 different areas that we talked about: airborne bacteria, dividers, solid dividers between calves, and the nesting score. So let's look at this graph. On the left-hand axis, it says prevalence of respiratory disease. So how many calves will have respiratory disease on a farm with these different criteria? And along the bottom is the airborne bacteria, the levels of airborne bacteria. So to the right, very high levels of airborne bacteria. To the left, not very much, pretty clean air. So if we look at the very top part of the graph where it says nesting score of 1 and a negative solid barrier. So that means the calves were laying right on top of the bedding and there was nothing between the calves. That, in other words, they had nose-to-nose contact. And if the airborne bacteria was very high, looks like about 60% of the animals would have respiratory disease. If we follow that line down with the open circles to the left, and we take it down to good air, we'd still have 30% of the animals having a prevalence of respiratory disease. So even with low air bacteria counts, we still didn't improve. I mean, we improved the respiratory disease a lot, but we never got it to the point we wanted to. Conversely, if we go all the way down to the very bottom with the dark squares on the bottom right, where we have a nesting score of 3 and a solid barrier, and we have even high bacteria counts, the respiratory disease was fairly low. So you can see in this example that nesting score and a barrier between calves was very, very important. So if we get up in the middle where it says nesting score of 1, 3, or 2 in that middle section, it's clear that if we don't have a barrier and we've got a good nesting score, we can have an impact by lowering the airborne bacteria. So if we got one of the things missing from the 3 criteria up above, we can really get a benefit by lowering our airborne bacteria. So studying this chart, I think, goes a long ways to help people understand what are the things we have to do in our calf facilities to create the best chance that a calf will avoid respiratory disease. Let's talk about bloat. So there's some key factors about abomasal bloat that we need to discuss first. One, it can be a combination of many things that cause the problem. And like I'd already mentioned, is typically in those younger animals, oftentimes less than 14 days of age. And what happens is that we get a slowing of the emptying that allows the feed to move out of the abomasum into the small intestine. If we slow down that rate of emptying, it allows bacteria to grow, and the type of bacteria that can grow in there can be clostridial organisms. Clostridial organisms will produce a lot of gas, causing the stomach to balloon up and cause a lot of pain for the calf and a lot of damage to the calf. Things that cause this slowing of abomasal emptying, oftentimes it's related to milk replacer mixing. So are we mixing to the right solids percentage? Do we have the right temperature at mixing and feeding? Do we want to avoid the temperature being below 100 degrees Fahrenheit? Are we making sure that we don't get settle out? We like to have consistent feeding times. And don't add things to the milk like electrolytes that can increase the concentration to get it way higher than what is acceptable for the calf. So consistency is all about what we're talking about, making sure we're doing the exact same thing every feeding for these calves. The next thing is the type of bacteria is almost always Clostridium. And Clostridium can come about from dirty equipment. It can come about from just a pure sanitation standpoint. So we can either create an environment in the calf's stomach where the Clostridium grows really well, or we just feed a lot of Clostridium bugs because of contaminated feed or equipment. So we're going to move on beyond the discussion of the diseases, and we're going to talk more about prevention of those diseases. So when we talk prevention, we're really talking about 5 areas: colostrum, ventilation, vaccination, sanitation, and making sure the calves stay hydrated. So let's start with colostrum first. We've already talked about this a little bit. We talked about the immunity that a calf has coming from colostrum. And we also talk about the immunity that a calf achieves through its development of its own immune system. So we have to balance that immunity compared to the load of pathogens that the calf is exposed to. So there's always a balance there. So the immunity that we get from colostrum, vaccination, good nutrition, a good healthy calf, compared to a calf that's exposed to inadequate housing, poor sanitation, or exposure to lots of different calves that come into the farm from other places. So biosecurity, sanitation, and housing really are the biggest factors in the pathogen load. And then again, we have to have that balance between adequate immunity and pathogen load. Passive transfer, what that means is we want the immunoglobulins that are within the cow's colostrum, within the maternal colostrum, to be able to transfer into the bloodstream of the animal. And the way that happens is the colostrum goes into the mouth, into the stomach, into the intestine. And the intestine at that stage, when they're less than 12 to 24 hours old, the intestine is very permeable to allow these big pieces of protein called IgGs to be able to pass into the bloodstream. This is a very key component of it because once those IgGs start passing, it sends a signal to that intestinal tract that it should start closing down those gaps in the intestine between the intestine and the blood vessel. So that's why it's important that when we start feeding colostrum, we finish the job and we give the adequate amount and we get it into the calf early. So why is successful passive transfer important? What's the big deal about it? Well, we've already talked about that the calf gets their immunity from their mother through colostrum. But when we look at all of the information out there, all the research data that looks at the effect that happens when we don't do it right or when we do it well. And we can see from NOMS data in 96, there was clearly reduced treatment and mortality rates. Several different studies looked at improved growth rates and feed efficiency with a good passive transfer program, a good colostrum program. There was even one study that showed a decreased age at first calving that was related back to the colostrum program at birth. And then finally, amazingly, we have an increase in first and second lactation milk production that can be tied back to a successful colostrum program. So how do we know that we're getting that occurs, that the colostrum program is doing what it's supposed to be doing? Well, one way we can do that is monitoring the serum, the liquid that's in the bloodstream, for total protein. So when we look at serum total protein, it's an indirect measure of IgGs. So we want the IgG levels to be at the 10 milligrams per mil or 10 grams per liter. That's saying the same thing. And then we can use a refractometer to give us an estimate of what that total protein is that will then relate back to those IgG levels. So what do? We just bleed a bunch of calves that are between a day old and 3 days old, and we want the total protein level. We want over 90% of the calves should have a total protein over 5.0. Some people will say 90% should be over 5.2, and we want over 80% of the calves to be over a total protein of 5.5 grams per deciliter. So that becomes our goal. Total protein is an indirect measure of IgG levels. Very useful test. So how do we go about measuring colostrum quality? That's an important part. We have to put good colostrum in to be able to achieve an adequate passive transfer. So we can use an old-time instrument that was a hydrometer, which was renamed a colostrometer, that measures specific gravity. These glass bulb types of things were very easily broken, not very durable, and also they were very sensitive to temperature of the colostrum that they were measuring. People are obviously looking for a better way of doing things. They looked at the Brix refractometer as a way to be able to estimate the quality of colostrum. This type of instrument is very durable, doesn't depend on temperature. They have a temperature compensation built into them. And the researchers determined that a Brix greater than 22 or 23, some people will use, is an indication that the colostrum is good quality and suitable for feeding to your calves. So sometimes with the best of efforts, colostrum programs fail. So let's look at a few of those reasons. Number one, we can think of quality. The quality of the colostrum can be variable. The level of IgG in colostrum can be low. Sometimes this is seen in first calf heifers that will have a lower level of IgG. It's not universal, but obviously something we have to keep in mind is the quality of colostrum for heifers. Quality of colostrum can be measured in the amount of bacteria that's present in it as well. So we have to think of it in terms of IgG and bacterial load. Quantity obviously can be a big factor certain times of the year where cows just don't produce very much colostrum. And of course, when we feed colostrum, is also very important. And we've already mentioned that a couple different times, that we've got to get that colostrum in ideally within the first 2 to 4 hours of its life, and certainly within 6 hours. So anything less than 6 hours should be a farm's goal. All right, let's move into the environment. Let's talk about ventilation. As you can see in this slide, these calves, there's going to be a lot of calves in this barn, all of them nose to nose, and nose to nose from the sides and from the back. So as we saw in the University of Wisconsin graph, those calves that we saw in the previous slide that would have a lot of nose to nose contact, even with good ventilation, that could be a challenge in solving or preventing respiratory disease. But that means we don't try. We still need to have good ventilation, and some goals that we can have for ventilation is in wintertime, we need 4 air changes per hour without a draft. That's what we need to shoot for in our ventilation system. In summertime, it's a little bit different. We don't care if we have a draft. Actually, a draft in the summertime is actually an advantage. And there we want to have a lot of air changes an hour. And mostly that's because we get more bacteria growing in the calf barns when it's in the summertime than we do in the winter. So either way, winter, summer, spring, or fall, we want to make sure our air is clean. And we can think about the thermal stress of hot weather as well. And wintertime, we really need to think about that adequate bedding for the nesting that we already talked about, where we have that nesting score of 3. And then again, no matter what kind of system we have set up, we should have proper pen space per calf. The University of Wisconsin has done a lot of great work on ventilation plans for calf barns using what's called positive pressure ventilation. These calves are put into these barns, and what the university does is says, okay, let's look at the barn dimensions, how much space is there per animal, and then based on the barn dimensions, we're going to determine the fan size. The fan size then determines what the size of the tube that we put into this building, and then the hole diameter and the position of the holes in the tube are set according to the needs of the calf. Air speeds become real important. We want to have still air in the wintertime, at least 4 feet above the floor of where the calf is, so we're not drafting the calf. Air speeds become important, especially in wintertime. So let's move into vaccination. Remember, this is the second part of our building immunity for calves. So we've already seen this before. We have to have the balance of immunity versus pathogen load. And remember, the 2 main components of immunity is colostrum they get from their mother and the vaccination to help stimulate their own immune system. And of course, nutrition is going to be a big part in helping the calves mount the best immune response to the vaccines. Also recall that if the pathogen load is extremely high, even the best immunity programs are going to overwhelm a calf's ability to fight off disease. What considerations do we have for vaccinating young calves, especially very young calves that are within a first week to 2 to 3 weeks of age? We really have to think about, does the vaccine really work in the immature immune system? Secondly, we have to make sure that it's safe. We don't want to give a injection to an animal if it's going to cause more harm than it is good. We have to keep in mind that if we give a vaccine to a calf that has been fed colostrum, will the immunoglobulins from the colostrum neutralize some of the vaccine virus or vaccine antigen? And finally, is the calf healthy? We don't want to be vaccinating calves that aren't doing well, so make sure the calves are healthy. So when we're going to vaccinate young calves, one of the most important things we have to think about is what's the history? What's the disease history on the farm, or even what's the disease history in the community? The local veterinarian is going to be the best judgment of what's the best vaccines and ways of vaccinating calves and timing of vaccinating calves. So what are the challenges? What ages? What time of year? And what particular management challenges or practices that are going on the farm that can help or set back a vaccination program? These sorts of things are best handled by the local herd veterinarian. So what do we have to think about when we're vaccinating these baby calves? Only use what vaccines are necessary. Avoid using systemic vaccines. In other words, a systemic vaccine is one that is given through a needle. Try and avoid that age group of animals that are under 1 week of age, or they're between 3 to 5 weeks of age. Between 3 to 5 weeks of age, those animals are starting to lose their maternal immunity, and any type of vaccine that we give through a needle might stimulate the animal inappropriately to cause more trouble than what they'd gain through that time period where their maternal immunity is starting to wear off. So the window of opportunity, 1 to 3 weeks of age. And make sure those calves are healthy at that time period too, because remember, that's also the scour period that we have to think about in these babies. When we read a label for a vaccine, we can see certain types of wording on the label. And we can have 5 levels of label claims. So the top level is prevention of infection. Not very many vaccines can meet that definition, that it prevents all colonization or replication of the challenge organism. Then the next one, prevention of disease. Next one, aids in prevention of disease, and aids in disease control. So those 4 are the most common ones you're going to see. There might be some other claims that you may see on these vaccine labels, but just recognize that there's different levels of protection that vaccines can provide. Again, prevention of infection would be the top level. One of the best things that we can do to prevent scours in calves is make sure that the colostrum that the calves drink right after birth has got the best kind of antibodies against scours type of organisms. There's 3 products that are available: Scour Guard, Scour Boss, and Guardian. Those 3 products are vaccinated into the cow to enhance the colostrum. Most typically, these vaccines will require 2 doses initially, then an annual vaccination after that. It's really important to make sure you get those 2 doses in the first time. So that spring and heifer be the one that we'd be looking at to make sure she had 2 doses, and they have to be administered according to the label of the vaccine. There's another calf scours vaccine that is provided to the calf right after it's born. It must be given orally before colostrum. This is called Calf Guard. It's a modified live virus vaccine made up of rota and coronavirus particles. This is a form to stimulate the calf's own immune system to ward off the disease. And again, it must be given before colostrum. So let's look at this graph, the level of production or protection. So if we put these vaccines into the cow and provide better quality colostrum to the calf, at birth, there's a high level of protection coming from that colostrum. Now that compared to the newborn vaccination using Calf Guard, we give that at birth, but it takes a while for it to develop an effect. So you can see that there still is an advantage to make sure we vaccinate our cows, especially again, give that first lactation animal 2 doses separated by the time frame recommended by the manufacturer. So let's talk about respiratory vaccines. Probably one of the most common new vaccine that's out for baby calves now is Enforce 3, made by Zoetis. And it adds BRSV, bovine respiratory syncytial virus, to the mix that used to be called the TSV2 vaccine. That was IBR and PI3. Very, very nice vaccine. Almost all calves could benefit from the Enforce 3 vaccine. There's another intranasal vaccine that's been developed for Pasteurella protection that allows calves to receive this type of antibody stimulation without the stress of the injection. So once PMH is another intranasal vaccine that can be given typically after 1 week of age. Another very, very common respiratory vaccine is Bovishield Gold. It's modified live for injection into adults. It can also be given later on for immunization of calves, typically in that 60-day age range. At some point, maybe before weaning or slightly after weaning. Just remember that these types of vaccines need a time for response to occur, as shown in the previous slide. So this is an example of what a vaccination schedule would look like. There's no way to suggest that this is the only method of providing these vaccines. It just serves as an example of what a schedule might look like. And you really should be encouraged to work with your local veterinarian to help establish this schedule. Vaccination guidelines. Follow the label. If it says to booster it and when to booster it, do so. Because if you don't, you wasted your money on the first dose. When you're dealing with gram-negative vaccines, and again, this is an area where your local veterinarian can help you, you should give no more than 2 of these types of vaccines in the same day. Keep in mind also that any vaccine can have an adverse reaction. Be prepared for treating these adverse reactions by having your veterinarian set you up or work with you on actually doing the vaccinations themselves. So be prepared in the event that you have a calf that has an anaphylactic type of reaction. And finally, avoid other stressors at the time of vaccination. So don't do things like castrating or deorning or moving animals or weaning when you're vaccinating. Those are all other stressors that are going to diminish the type of response you'll get from the vaccine. So another common cause of scours that occurs later on in the calf's life, typically around that 18 to 21 days, is coccidia. Coccidia is a protozoan that's just very common to see in the environment. It can cause a pretty severe diarrhea that may or may not contain blood. The nice thing about coccidia, if there is such a thing, is that there's very effective prevention and control methods available using decoquinate or Decox, Lasalicid or Bovatec, Amprolium, Corid, that's another name for Amprolium, or Monensin, or most commonly called Rumensin. So those are all very good products for preventing or controlling coccidia and should be considered in all calf raising operations. Another very common cause, as we've already talked about, is Cryptosporidia. Another protozoan is very resistant to antibiotics. Calves typically will scour at any time, 7 to 21 days of age or older. Coccidia can be present all the time. Almost every fecal test that's done on calves will find some level of crypto. So the best types of prevention and control is making sure that there's good nutrition, that you have plenty of fresh water, that the calf is clean, and you give the various type of supportive therapies for scours control, and calves will typically do very well if with their exposure to crypto. But you need good nutrition, fresh water, and supportive care. So talk about sanitation. Let's get into that topic here a little bit. So sanitation is really all about reducing pathogen load. And here's some ideas that really do work. When you store your milk replacer, keep it in a clean container and make sure that container gets cleaned. All the other calf handling and milk handling equipment should be sanitized. Store the equipment so it dries quickly and dries easily. If you're in a hot, humid building that has poor airflow, consider taking a dry towel and drying the equipment so it has a better chance of drying and staying clean. And in your housing, try and still shoot for an all-in or all-out type of housing so you can clean up between groups of calves. When we talk about scouring and we talk about other types of diseases, it can quickly cause an animal to lose their level of hydration. They either lose it through scouring or they lose it because they're just not drinking enough water because they don't feel well. So when we look at the severity of dehydration in animals, it can be a range from usually anything from they're fine, they don't have any body loss of water, all the way up to 12 to 14% of the animals are losing water. When we get to that point of between 8 and 10 or 8 to 12% dehydration, we need to get intravenous fluids into these animals. It becomes an emergency. These animals are very, very ill. When they're 2 to 4%, they're going to be mildly depressed. Some farms won't notice it. Others pick up on it right away. But when you get over that 4%, that's when we start seeing sunken eyes, dry mouth and nose. They might still be standing, but those animals are quite depressed. And of course, when we get out beyond that 10, 12, 14%, these animals usually don't make it. So the key thing about dehydration is staying ahead of it. Don't allow the calves to get so severe that you see that their mouth becomes dry or their eyes start sinking in. You have to stay ahead of it. It's better to use electrolytes early before the condition becomes serious. So there's some key components in electrolytes. Glycine, it helps with the uptake of energy. The glucose or dextrose, it's the simple sugar that's the form of that energy. Sodium, potassium, and chloride are key electrolytes that really help get the body's system back to where it needs to be, because oftentimes with scouring, for example, they'll lose those electrolytes in the scour manure, in the diarrhea. And the other thing is it's nice to have some buffering agents. Bicarb is a very common one. Acetates and citrates are present in many of today's electrolytes. They do a real nice job as a systemic buffer rather than just buffering what's happening at the gut level. And finally, if some calves get really bad, it's a good idea to learn how to give intravenous solutions of electrolytes. If that seems to be too difficult, I've found that subcutaneous solutions can be almost effective. You just put the fluids underneath the skin of the animal. These are special fluids that are used for giving IV. Don't use the oral electrolyte solutions under the skin, but use whatever you can use intravenous. You can also put underneath the skin. Very easy to do, and I think very, very effective. So what's the protocol for oral electrolyte use? Keep them on milk. Milk is a very important piece of this whole process to help calves recover from dehydration and scours. They need the energy. So feed your milk in the morning, wait an hour, give a couple quarts of electrolytes. You can feed your 2 quarts of milk in the evening, wait an hour, give another 2 quarts of electrolytes. And oftentimes it can be real beneficial to these calves, especially when it's hot weather, to give electrolytes midday, depending on how warm it is and just how they look. Are they getting sunken-eyed in the middle of the day? Good idea to give them some electrolytes and fluids then. I really don't like the idea of putting electrolytes in the milk or milk replacer. Avoid that. Calves need the water that comes along with electrolytes as well. Usually keep up this type of regimen for a couple days. If they don't seem to be recovering, it's time to reassess and perhaps get some help from your veterinarian. And always make sure that there's free choice water, good quality water in front of these calves at all times. So when we first started out looking at those numbers, we still have a ways to go to improve the disease levels that are in calves across the country. We absolutely are sure that colostrum is the first line of defense, that passive transfer. Vaccinations are very beneficial, especially when sanitation, ventilation, and nutrition are adequate. But all of it has to work together. This whole idea of having a healthy birth, colostrum, good nutrition, a very, very good environment.
Thank you for completing this Calf Academy course. If you have follow-up questions, please contact your Milk Products National Account Manager.